long one. Hello, can you guys hear me?
Hello. Yeah, we hear you.
Oh, hi.
How are you?
Okay, good, good. I was just wondering, I was like, hey, I hope this system is not gonna fail today as it did on Friday. Okay, so today we are going to start with a new module. This is pharmacology. Introduction to pharmacology. You need to know certain things about pharmacology. It's just part of the curriculum. From pharmacology is going to be very few questions for your exam, but it's part of the requirements. So we're going to kind of overlap some information, particularly the first couple of chapters, because it has to do with patients' education. But this is patients' education when it comes to taking medications, getting familiar with the medications, patients' compliance, which means why is it that the patients are not taking the medications on time or not taking it at all? So it's very important that we need to educate our patients every single time that the medical provider prescribing medications. So, make sure that you reinforce that this medication needs to be taken religiously. If they don't, then the medication actually is not going to work. And what happened when the medication do not work? Patient is going to start calling, patient is going to start coming back to the office, patient start blaming everybody else within the facility. But sometimes the responsibility falls on the patient. So for that reason, we are going to get these first two chapters, um, you know, talking about exactly how we are going to make sure that the patient actually understands their recommendations about, taking the medications appropriately, so to speak. So that's basically what it's going to talk about, what is medication, what is a drug, types of medications, schedules of medications, controlled substances. Even though if you don't have to prescribe medications, with medications, you don't have to do much because mostly medications are administered by nurses, medical doctors, other higher level professionals. You still need to be familiar with pharmacology. So that's basically what it is. Remember, patients are going to stop in the office complaining about the medications that were prescribed to them, and they have some side effects, which they call allergic reactions. So we're going to understand exactly what is a side effect or a secondary effect of the drug, what is exactly an allergy to a medication, so we can understand, if we as medical providers understand these definitions, we're going to be able to talk to the patients, and particularly when they are over the phone, because they might stop taking the medication thinking that they're having an allergic reaction, whereas it is just a side effect, an adverse reaction of the medication. Yes, it's complicated, but it's not complicated as if it were an allergic reaction. And sometimes just having an adverse effect on the medication, you should not stop the medication, except in certain situations that we are going to discuss. This lecture is not just good or important for your patients, but for us as well. We also are patients. We also take some medications, or our family members or our kids takes medications. So sometimes as parents, whatever happens to the child or to an elderly person in your family, or ourselves start having some side effects, medication, the first thing that we do, we draw stuff and we call the office and all these things about the medication. But if you understand that, that's going to be a different issue. Oh no, this is not happening. Oh, something happens for a little while. This screen disappears from me. I was like, no, this is not going to happen again. I just changed internet companies because the other ones gave me a little hard time. So I changed companies. Let's say so that is better. Otherwise, I need to. Okay, so that's basically what it is. It's very important that we, as medical provider, remember, you're a medical provider. Medical provider is not just a doctor. It's a medical office. We provide services. Regardless, it's just that you're not going to prescribe, you're not going to diagnose, and basically that really does everything else. That comes into the patient. Medical doctor, referrals, you check insurance, you do a lot of stuff. So if you are an important in an office, this profession did this. So every single person who works in a medical office is crucial, it's vital to the office. Remember, a medical doctor cannot be registering the patients, drawing blood, collecting urine, doing the high and weigh, and the vital signs at the same time and seeing patients. We need you. We want you. There are many, many positions, many job openings for medical assistants. I was checking not long ago, and there are a lot of offers for medical assistants. And the price range goes in between $20 to $30 per hour. So that is not bad at all. And do not worry about experience. They usually say, I need someone with experience, but you have that position in your hands when you interview with them, because you're going to tell them that you just graduate from the school, but you're willing to learn as much as possible in the office, and definitely they're going to give you the opportunity. Remember, I start as a medical assistant. I was hired that right, not off of my internship. During my internship, I was doing my first week of my internship, and they hired me. So just make sure that you are positive about it, that you are go get it. You can't be just thinking, oh, no, I'm not gonna apply for that job because they're asking for experience. Send your resume. Always send your resume. One of the things that you need to know is that have a very well done resume. The school helps you with that if you don't have your own resume, or you don't have a resume tailored with the new training that you just getting. But you have to put yourself up to date. Remove things that are not needed, because in a resume you can't just put everything that you have done. It has to be mostly everything that is related to the job offer. Because if you place things that are unrelated, chances are you will not be called. I'm telling you. So fortunately for me, when I came to this country, I have just one prior job. That was a nonsense job. But then everything else, I put there that, went to school, I did this, and hey, I just went to do my internship. But you have to be, positive that things are going to go well. Okay, so once again, welcome to this new module. Some of chapters be a little detailed. pharmacology, but once again, just need to know where to understand. Once again, for the national exam, will not be many questions from pharmacology, but you do need to understand certain basics. It won't be any of that, but you need to understand, particularly because the exam questions wants to know whether you are familiar with these terms or not. So that's basically what it is. Okay, so dive into it with um, patients teaching and education. That is very important. Remember these chapters, this particular text for systems based on exams, particularly the national certification. It is part of the curriculum. Every single school needs to cover pharmacology to some degree. So that's basically what we're going to do. And it's very important. Even though if you're not happy in your exam, still you're going to learn a lot for you, for your family, for your patients. For the people that might ask you questions and then you know you're not going to be giving an advice or anything else, but with the basic knowledge, you can at least tell people, hey, do not take the medication with milk. Do not take the medication with coffee. Do not take the medication with soda because it's not going to work, your medication. Oh, you should be taking this medication on time. So those are very basic things. Oh, I have this abdominal pain. I have nausea. I have vomiting as I start taking this medication. I have an allergic reaction. No worries, that's not an allergic reaction. That's a side effect from the medication, but that side effect is going to subside after you take twice or three times the medication. It's just that the medication is getting familiar, your body is getting familiar with that medication, and that's why your body reacts to it. So that basically, so don't stop taking the medication, because if you stop taking the medication, then the condition is going to worsen. So contact your medical doctor, go to your doctor, but don't stop the medication. They will tell you if you need to stop or not the medication. That is exactly what you're going to learn for you, for the people that you know, and for your patients, because that is basics. And you are not prescribing. Definitely not. You're not taking the patient, wow, discontinue the medication and take something else. That will be different issue. But telling them not to do certain things because they think that, the medication is going to cause them more harm than good, then they're going to stop. But actually, these medications, once again, they're going to cause you some little changes in your body because the body's getting used to the medication. But after you consume the medication a few times, you're not going to have those side effects. Now, if the side effects continues, now it's a different issue. The medical doctor needs to figure it out, whether the dose was too high, whether the medication needs to be switched, changed. That's a different issue. But you're going to understand the purpose of this patient's education. Very important. Okay, so what will be some of the things that we are going to be learning in this particular chapter? So it says right there, identify the common causes of patient medications errors. Now, errors, as we are going to discuss, does not mean that we are giving the patient medication by error. No, it is certain things that the patient misunderstand because we sometimes are not clear giving them information. List of some problems patients have when they cannot read or understand health instructions. That's why we have to use a plain language. We have to talk to them in a language that they can understand. So later on, we're going to see at which level of education we need to talk to the patients. Believe me, we have heard these sometimes on TV and things like that. And it is true. We have to talk to them at certain level of, education. And you're going to be seeing why. Describe the process of teaching patients about medications as we have already, I have already explained it to you. So there are lots of things that we need to make sure the patient understands before they start taking the medications, because they have to take this seriously. Medications are very important. Medications help you with the condition, but if you don't take right, then they are not going to do the work that was intended. So patients' behaviors. Remember, compliance. Compliance is one of those issues that we have with in any single profession, so to speak. Compliance means that, the person does not follow instructions. That is compliance. If I tell you that you should be reading this chapter prior to the class, I'm just saying it. It's an example. Then you are not compliant with my instructions. If a patient is being told to take these medications first time in the morning before breakfast, after or in the afternoon or noon, before lunch, before meals, after meals, before you go to bed, and patients do not take those medications as directed, well, they are not compliant. That is basically what it is. And believe me, the medications are not going to work. Later on, I will explain why is it that not taking the medication at the same time every single day will not work. So once again, compliance means that you have to follow instructions, right? Now, non-compliance, you're not following instructions. That is obvious. So usually that is important to understand. Concordance. Now, concordance means like being in an agreement, being as a part of the team. Everybody who kind of interacts with the patient. When patients, that is called concordance. So we are working as part of the team. The medical doctor, the patient, the family of the patient, the pharmacy, all of us needs to work together. The medical doctor prescribes the medication. The nurse gives the medication to the patient. But guess what? Sometimes the nurse, before gives the medication, the nurse goes to certain follow certain guidelines to make sure that it's giving the right medication, that the patient is not allergic to that medication, so it gets a little more detailed. Now, if the pharmacy receives an order from the medical doctor for a medication, when they receive the order, they're going to go over all the same guidelines as the nurse did. Wow, this medication is going to be interacting with another medication that the patient is currently taking. This medication is contraindicated. This medication is the same medication or similar medication to one that the patient is already taking. Not good. So the medical, let's go back. The pharmacist is going to contact the medical doctor immediately. So they could not talk to them and tell the doctor that this medication has some interactions, or the medication is being given under another name for the same reason. So you cannot give the patient two medications or medications that are going to be interacting in between them. So see, that is concordance. We need to work as a part of the team. It's like the medical assistant assistant, the nurse, and the medical doctor, and whoever works in the office. We there for our patients something, an error, something that does not follow the proper procedures, the proper standards, it should bring it up before things get, complicated or some other situation might arise. So that's basically what we do. So it's not just the patient, it's us as well, the medical professionals. So all of us needs to be in some type and kind of, agreement so they can be in the same page, so to speak, when it comes to our patients. That is basically what is important. Communicating with the patient. Sometimes, if we do not communicate as communication skills that we learned prior in different chapters, because this is not new, then, if we don't know how to interact with our patients, then, it's going to be a problem. And there are many factors and barriers that can block communication with the patients. Medical assistant time constraints. It's not just the medical assistant, it's the medical doctor or the nurse. Remember, the medical doctors sometimes don't have time to explain the patient the ins and outs, so delegate some of the information to the nurse, to the medical assistant. So that's basically what it is. So when the patient comes to us, we have, reinforce that information that the medical doctor has given the patient, because the medical doctor didn't spend too much time talking about more details about the patient has to do with the medication. They delegated to us as medical assistant or nurses. So be careful. So sometimes you might be very busy. You don't have time to explain in detail the patient following all the instructions to the medications. Sometimes you don't give them written instructions, or you do not speak the language that the patient speaks. And I'm not talking about language barrier. I'm not talking about English or some other languages. We are going to go back to that. But here is that you are so caught up doing other stuff and falling behind in tasks that you don't want to spend time with the patient. Only medical assistant working in that office. So you don't have time to be explaining and guiding the patient. And sometimes, repeating the story, not once, but twice or more. So you might not have time for that. So that will be the medical assistant time to go over all the details that the patient needs to know before taking beliefs. Culture, you might be thinking that these medications that the medical prescribe are not good. I'm used to in my country to take this or that, home remedies. They go and take herbal remedies. They go somewhere else, not to the medical doctors to get their medication. Not trust or believe in medicine. So basically what it is, and they hear many things about medication. Medications are not good. Medication make you sicker. Medication this and that. So they take that, as the final word for them. So we need to educate our patients, not tell them that do not believe on the traditions and myths that they learn in their society and their culture. That's not what we're going to go and tell them. It's like, telling someone, hey, you should not believe in that religion. You should believe in mine. That's not true. No, we don't get involved on that. Remember, things that you should not be arguing or contradicting or, confronting your patients is with cultural beliefs, politics, religion, sexual orientation. Those things we do not get caught up in the situation because we're not going anywhere. It's just going to get things worse. Patients are not going to follow what you are telling them to do because they are not trusting you anymore. So your beliefs as a medical assistant should be separate from, whatever instructions or guidelines you're giving to the patient. Never get caught up in altercations with your patients when they tell you, I don't believe on this, these medicals are not good, this medication are good, a family member of mine died because I gave this medication, we are used to take this, so I don't even bother, all of those. Some others, they don't say anything, explaining the medications, because by the way, they're not gonna take the medication. So that's basically, but we do not get involved in that. Whether the patient takes the medication or not is their responsibility. It's our responsibility to let them know, to guide them, to give the appropriate instructions. Now, language is one of the major problems here in, well, not where I am, but I'm talking about the United States, because we have people from different countries with, speaking, as I mentioned before, every single time that we're going to give instructions to the patient, regardless of what the instructions are, but in this time about medications, we have to give the instructions in the language that the patient understands. Or if we do not speak the language, we have information is not only given verbally, but also written instruction. And that written instruction also needs to be written in the language that the patient speaks. What is the part? Well, actually, I feel offended if you do something like that, because I'm not going to be able to understand it. So in our office, get familiar that they have printouts for every single medication instructions or for any procedure that the patient is sent to do or to get. So again, we need to be familiar with all that so we can get the appropriate materials to the patient. Remember, a complication arises just because we are not giving the patient the appropriate instruction. That's called negligence. And negligence leads to a lawsuit if there are complications. So once again, it is important. It is important that we get familiar with all this. Let's continue with this communication with the patients. Patients' problems resulting from inability to read and write. Well, that's related to language barriers, but I mentioned already, how can we solve the problem? Remember, we need translator and we need written instructions in the language that the patient speaks. Poor health outcomes. Now, patient has been taking medications, but these medications actually do not improve the condition of the patient. Now, once again, that needs to be reevaluated by the medical doctor. Every single time that a patient comes to our office, we go over the medications that we have prescribed to our patients. How do we know? Because depends on, what is the reason that the patient is coming to our office? What are the complaints? So if they don't complain about this particular medical condition and the medication that they taking for that condition, they come with something else, then we address that issue. But when we prescribe medications for that second condition or third issue, well, we got to make sure that we see what other medication the patient is and making sure that the medication that I'm going to prescribe today for this other condition of my patient is not going to interact with the other medication that my patient is taking. That is the reason why medical assistants and nurses do not prescribe, because you do not have all this knowledge, all this training to figure out why is this medication not working. Remember, patients, sometimes if they do not comply, non-compliant patients, they're not taking the medication as prescribed, taking it whatever they remember they have to take it. Sometimes they skip the medication because they forgot or they have something else to do. So I'm not saying medication is going to work, but if it doesn't and you're taking it religiously as prescribed, well, then we're going to evaluate what is the reason that this medication is not working on this particular condition in this particular patient. So that's what we do the evaluations. But once again, as medical assistants, we are not going to get involved in this. And if the patient says, oh, this medication don't work, that is giving me all this bunch of medications and it's making me sicker and blah, 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 we don't get involved. Oh, yeah. They give you this, I know. Oh, those, yeah, they give you side effects. Yeah, I'm taking medications and yeah, that give me this and I stop taking it. You're not going to tell the patients stop doing it because you are non-compliant, because your patient might be in a different situation. And you are in the medical profession. And in the medical profession, we don't get involved in that because that is called malpractice. And that can get us in deep trouble. So just, oh, well, I'm here because, I'm still sick. That medication, that medical doctor didn't work, blah, 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 blah. Don't tell them, start questioning them. Do you take the medication as prescribed? Do you do this? No, because these people are not going to like this type of questions. Leave that to the medical doctor. You already explained then how to take the medication. Now it is not the time for us to intervene. Then talk to the doctor because we can make things worse. So that's basically what it is. Let's talk about health disparity. Think about it, our health system, right? Some people, don't get a good health insurance. Some people don't have health insurance. Sometimes, if we have this capitated health insurance or these government insurances, it's going to be very limited. So sometimes, we have to get pre-approval. Remember, insurance, health insurance for those who were here. So all that apply. So no, the medical doctor is not prescribing you a tray of brand medication because your insurance only pay for the generic. Oh, we don't have the generic for that medication. Then they're going to give you another medication that is generic, that is similar, but they're not prescribing you the brand because your insurance is not going to pay for it. So that's basically what it is. So those all, are considered health disparities because it's like, we have different levels, particularly what your insurance covers or does not cover. Increased risk for disease. Of course, these health disparities is going to increase the risk for disease if you're not taking the medication that was supposed to be taken, or you didn't get the procedure that was supposed to be ordered by the medical doctor due to all these regulations by, government and government insurances. Because if you have a private insurance or a commercial or group insurance through your employer, well, they paying for it, you paying for it, so you might get things done a lot faster. But for certain insurances, and not to mention, there are certain places that, actually they don't have um, medical facilities where they can go and receive their services. They need to move to another town because they live in a kind of small village. So they have to move, and sometimes they don't have transportation. Sometimes they are elderly patients. Sometimes they're children. Their parents do not have the means to move out, and so on and so forth. So undeserved locations, can cause health disparity. So that's basically what it is. So there are many, many, many situations, and we can consider this an issue to acquire, the medical health or services that you deserve. So that is what is here. So we have to take in consideration all these. Think about a patient who doesn't have a health insurance, but it doesn't have money to pay for these medications because medications are very expensive anywhere in the world. But particularly with the system that we have in the US, sometimes it's very difficult to kind of, receive the care that you deserve. So for that reason, we have all these issues with concomitant conditions. The increase on many conditions because patients have not been treated, prior to these conditions actually worsen because of the waiting time for them to get approval for this particular medication, or they just don't have the means to buy the medications themselves. So it is a big issue in medicine. The process of patients education. Now, again, if you have any questions, please, just jump in, let me know. If it is related, of course, if it doesn't have to do with the chapters, but it is related to the program, well, we can discuss it in different ways. Okay. Patients' perception of educational importance. See, sometimes the patient don't think that is important. They just go there and, hey, if they give me the medication, fine. Well, they receive the medication because they want to solve whatever symptoms they have. But they actually don't pay attention sometimes when we are explaining them verbally the instructions or how to take the medications and why you shouldn't be taking these medications in different times. Why you shouldn't be taking the medications after or before meals. They do not understand that. So it is very, very difficult for us to try to, you know, change the patient's perception about medicine. Sometimes they just don't trust us as a medical providers. Once again, they hear all these narrative and internet, social media, neighbors, people talking about how bad the medical service are, and the health services are not good, and all the side effects of the medication. So they believe everything that they hear. So they show no interest sometimes for whatever you have to say. Nurse or medical assistant versus patients. Now, once again, one that has the knowledge, the other one that doesn't, but still, the one that wants to get this information through, patient is not kind of interested. So that's basically what it is. It is very, very difficult. Remember, one of the things that we always talk about in the health services is, patients' compliance, regardless of the reasons. It's just that they do not follow through. I'm not talking about every single patient. But to be honest with you, 95% of the patients do not follow instructions as prescribed, as ordered. Yes, they follow, but once again, taking the medication at different times when it's not supposed to be taken is not following instructions. So that's basically what it is. Sometimes the medical professional says, well, I'm giving you the information. If you don't want to listen, if it's kind of you have it in your brain. I'm going to explain you this, but I have already thinking that, hey, probably you're not even listening to me. Probably you're not even going to follow this. So I'm kind of, taking it back, kind of not explaining everything in detail. So we need to change that, perception of our patients about medical and tell them things the way they are. That's why the medical provider needs to discuss with the patient prior to the patient leaving the office. When they have ordered a medication for them, talk to them, explain the medication, explain about side effects, allergic reactions, because this is one of the topics that the patients really care about it. Remember, if I take a medication and I develop nausea, believe me, I'm going to stop taking the medication if I'm not medical related. If I develop some side effects, some adverse effects, which is the same, whatever it is, headaches, like I become dizzy, I'm not going to take the medication. By the way, I got a medication for my allergies because I developed allergies to the season, particularly to pollen, dust, fumes. I didn't have those allergies before I moved to the US, but I got them. For some reason, I got them, maybe because my age, maybe because of the changes. I don't know, something happened in my body. I tried different medications, not different, all of the medication for allergies. Some of them work at the beginning, then they didn't work anymore, but then I changed them. The last one that I was using is that nasal spray. It worked wonderfully. I was like, wow, this is the medication that I should have started to begin with. But I start with other stuff, like Allegra, Zyrtec, all those nonsense, antihistaminic medications. But I do understand the process and I do understand when they do not work. And I'm not going to take more than I was supposed to because I'm going to have side effects and that is not good. So I just switched medications. When I got to this one, hey, I was like so happy because I just put one spray in each nostril and I left my home in the morning, particularly in the months of December, January, February, March, probably April. I was using the medication. One day I was going down, stairs on the train station and I almost blacked out. I felt like, everything blacked out, like I was going to collapse. I was like, oh my God, that is a heart attack. But I said, I don't have medical conditions, but probably I have it and I don't know. So I start thinking about, things right at that moment that I felt like I was going to fall. I grabbed, like the rail right there by the side of the stairs. And I start thinking, breathe normally, you're going to be fine. Start telling me things. So that's what I do. Then I said, oh my God, how did this happen? I called one of my friends, medical doctor. I said, listen, I need to see, I need to see you. Can I go tomorrow? Because, I was doing this and this happens to me. Said, sure, come on, you come on at any time. So I was going to stop by the hospital. At the next day, I got caught up with something. I didn't go. You see, patient compliance. I used the medication the next day. Nothing happened. At the following day, I used it again. And again, I felt like it was going to fall. I black out for seconds. You know what I did? I said, no, this has got to stop. I'm going to see my friend right now. So once again, I went to do whatever I was going to do. Said tomorrow morning I'm gonna go there. But when I got home, I thought that okay, what can be causing this? I got into the internet, tried to figure it out other things because I don't have medical conditions. I checked my blood pressure, my pulse, everything. I said something is gonna be wrong. Then I said, oh, wait a minute, what about side effects? So I actually went and I got the little bottle of the spray and I said, you know what? I'm taking this medication, but I never checked what are the complications. One of the first things that I read when I was reading the side effects, it says, oh, is it give you, dizziness, vertigo. You can black out at this, oh, but I have the answer. So then I stopped taking the medication. That's it. Finito. No more. But that was a good medication. Now I kind of, getting along with. And I try to winter time move to my country that is, hot weather. But not every single patient can do that. But once again, what I'm trying to tell you is, make sure that, read the side effects. Every single medication comes with an insert, not the label on the bottle. The label on the bottle is not going to tell you much. We're going to go over that. The insert, when it has what is the indications for the medication, some of the complications, adverse effects, contraindications, toxicity level. But if we don't read that insert, probably we're going to stop taking the medication, thinking that, you know what, this medication is doing worse than, good. But your medical doctor needs to explain you not every single side effects, but, the most common complications for certain medication. Now, that happens to me. That does not imply the same medication is not going to work for someone else. No, because the other medications that I was taking, all of these antihistamines, none of them cause anything to me, no side effects, but this one. So that's basically what it is. So be careful with all that. Next, patients seek out the resource persons they feel is the best source or the one they are most comfortable with. Believe it or not, patients believe more on the neighbors' information about medication or the media versus the medical doctors. So that's something that we cannot change. We try to change, remember, this perception about medicine, but some of the patients, they just have it in their brains. And once again, they believe more a neighbor, a family member, the news, fake news sometimes, versus the medical providers. Nowadays, patients are more informed because of the internet. So as soon as they, get something, a condition, they go and look on the internet. But you remember, the patients do not know what condition. They cannot diagnose themselves. They just see a bunch of symptoms. And every single symptom most of the symptoms are very general symptoms that can apply for different conditions. So how does the patient knows what exactly they have? Remember, you can go to the internet, but the internet does not always tell you the truth. You have to go to the sites that are government sites where the information is reliable. You can just Google it. That doesn't work that way. So patient needs to, understand that. It's not that you're gonna tell them, hey, do not trust the internet. No, the internet have sources that are government sources that have done research about this to educate the population. But that is not the last word. This is just for them to have an idea that something serious is going on. You must make an appointment with your medical doctor and tell them what the symptoms that you're presenting with. And maybe the suspicion about, probably having this condition. But don't take all the information that you do find on the internet as your diagnosis, because you're gonna have like 100 diagnoses. Because once again, these symptoms that you are presenting with might be common to tons of different conditions. So how you gonna make sure that you're gonna you know, kind of find a differential? Well, going to your doctor, they're going to run a bunch of tests. It's not based on your symptoms alone. Remember, that is the good thing about the medical providers. Now we are going to run all your symptoms, and then we're going to ask all that. We're going to do physical exam. We're going to collect your urine. We're going to do blood. And if it is required, imaging reports or whatever other body fluid we need to collect or a tissue. Then we're going to come to a conclusion of something that you may have. But just reading on the internet, that doesn't work. So some people just believe what the internet says or what they think that might say and what they recommend to take. And probably you're going to be taking something that is not for the reason, for the purpose or the condition that you actually have. So you have to see a professional. The patient never reads the warnings and the disclaimers that they have in all these websites. So don't take this information as a diagnosis. If you present some of one or some of these symptoms, you need to see a professional. But you don't read that. You just wants to read whatever, the symptoms that you are presenting with that are very similar and what recommendations they give you. You just auto-medicate yourself, which is not good. So computers are good for some reason, but if you don't know how to use it, that can get you in deep trouble. So that's basically it. So tell me, how many of you have gone to the internet trying to check symptoms that you have presented? All of us, mostly, except for the elderly, the ones that are not familiar with computers. Well, they're kind of safer because they are not getting all these extra details about conditions that they don't know how to solve. So sometimes too much information is not good, and not understanding the information just make things worse. So think about it. Next time that you find yourself in that situation, do not go through that. Yes, check the internet, but then, go to your doctor. Do not take medications upon yourself because you might take in the wrong medications, causing yourself more harm than good. Okay, so how do we assess patient understanding? So how do we know that the patient understood the instructions that we gave them? Well, there are different approaches that we can use. First of all, once again, the willingness to learn. You can see the demeanor of the patient when you're talking to them, whether they are actually paying attention when you're talking and explaining, or they just kind of disregard you. We know, but our job is to go through it. If you see someone kind of distracted, you know, not caring about, all the information that you're giving them, just go over. That's our job. If they don't want to pay attention, if they don't want to learn, that is something that we cannot control. We try to do our best. So do they really want to learn, or they're not interested? Because some of the patients, once again, they are too much into the condition that they have and the suffering that they're presenting that they don't see solutions for them. They just become very negative. Oh no, they have tried these medications all the time, giving me this, giving me that, adding one medication, removing all, I'm still sick, still don't get better. Remember, the misconception of the patients is that, that the medication that we give in them is to completely get rid of the problem. That is not the intention of medications. In some situations, yes, some others don't. When it comes to infection diseases, yes, medications are done with a purpose to kind of eliminate the problem. But when you have chronic conditions, no, you have to deal with it. And what we're trying to do before we fix the root of the problem is to give you medications for the symptoms. If you have pain, we are going to give medications to fix that. But it doesn't mean that with this dosage of medication that you're taking, the pain is going to go away forever. No, you're probably going to be taking these medications as long as you have the problem. So that's basically what it is. So the patients do not want to be taking medications all the time. So that's one of the reasons why they just don't trust us or the health industry. So that's basically what it is. So we have to place ourselves, remember, we have to be very sympathetic because that can happen to us. If you have a medical condition, a chronic condition that you be taking medications and sometimes they work a little bit, but then the condition comes back or rebounds. So then once again, we kind of not trusting the system and probably not trusting the medication that we're taking. But these medications, once again, are not to get rid of the condition. This is just to keep you moving so you can do your daily routine activities without, the hassle of having this pain or this dizziness or whatever else. So that's basically what it is. So very important for us to understand those aspects. We're not trying to convince people, to convert them, to believe that everything that we do is going to cure them. Because remember, sometimes it doesn't work. Certain medications just work temporarily because that's the purpose of the medication, to work temporarily for a condition that you may have. But you might have to be taking these medications, on a regular basis. That's called maintenance. So that's basically what it is. Types of teaching methods. Well, just like you guys learning here, your patients, because we are patients, remember? We are human beings. We learn and we have different approaches to learn. But you have to have different techniques to get this information through your patients. For that reason, You know this, and this is very common use. We use verbal communication. But when we use verbal communication, remember, we have to use simple terms, terms that the patient can understand. We have to put ourselves on the patient's levels of education. Don't talk like a medical assistant, like a nurse, like a medical doctor to your patient, because they will not understand anything. Not only they're not going to understand, they're not going to trust you anymore because they feel that you're trying to confuse them because you're giving information that they cannot grasp. Now, remember verbal techniques or teaching methods. Once again, it has to be in the language that the patient speaks, whether it's through a translator, a family member, or the professional that is talking to the patient, but it has to be delivered in that way. Layman terms all the time, simple language. Written instructions, we talk about this every single time that we give up the patient verbal instructions, has to be accompanied by written instructions. Same way, in the same language, in this language that the patient speaks. Simple terms, things that, patients can read and understand. It can be through audio visual, material. Sometimes seeing, watching a video or following some guidelines through, images, it can deliver the information better than anything else. Most of us are visual. If I show you a video, you're gonna understand better the procedure than if I talk about it. Or hands-on if you do it, but with the patients with not some of the time, yes, when we explain them or when we try to give themselves insulin or to do the finger stick. It has to be they can do it, and we can watch them when they're doing it. So that's basically, how we can utilize these teaching methods to get this information through the patient, to make the patient a little more concerned about their health because they think that there are these things they understand, that they can do it. Of course, can be a combination of all these. A combination always works better. See, I talk to you, I give you some information, and then I show you a video. Or I talk to you, I explain you something, then we do it. So that's basically what we practice it. So that is a lot better. And that is like a complement of understanding what is being given verbally or written, because combination of methods definitely is going to reinforce knowledge. So once again, how do we assess that the patient actually understood what we already went through or explain is to get feedback from the patient. Whenever I give instructions to someone, I don't give all the instructions at once. Why? Because if there are many instructions, you're going to get lost right there because there are many of them. How am I going to remember all of those? So let's go 1, 2, maybe maximum 3 steps. Let's go back. Okay. So can you please, tell me what we went through? Can you do it? Can you repeat it back to me? Yeah, you told me that, this medication, I have to take it first time in the morning, usually at the same time. I have to take it with water before meals or after meals. Oh, great. Remember, you have to price your clients, your patients. If they make a mistake, do not say, here we go again. You're not getting it. No, that's not what I said, no, we do not go like this with our patient. Remember, they are adults. You don't want to be punished for not learning the lesson. Well, the first step, excellent. The second step, kind of halfway. Let's go back again. Let's do it this way. Now you see them giving them 3 steps is too much for them. Give one by one and then feedback. Can you repeat that for me? Yes, I have to take this medication first time in the morning. Oh, sure, definitely. Oh, I has to be fasting. Excellent. Next, we're gonna go through that. Always encourage your patient. Do not roll your eyes. Do not look that you are uncomfortable, that you are bored because you've been saying this many times. Remember, sometimes we have to spend time with our patients. And to get all this information through, do not give up because not everybody learns the same way. So if you have a family member, explain the family member as well, because that family member can reinforce the information. Or a home care agent, someone who's working with the patient or alongside the patient. Family is always an asset for us. It can be used up, as this channel to reinforce all those instructions that we give to the patient, to remind the patient that they have to take the medication and how medication needs to be taken. Remember, this is crucial because if you don't take the medications as prescribed, unfortunately, these medications are not going to work. And the condition is going to worsen. And the patient is not going to believe in the system. So they don't trust a little, south, then immediately they start kind of, assuming that they were right, that we are not good, that the medication is not good, that the health system is not good. So that's basically what it is. So remember questions for exam as, we discussed in prior modules for those new ones. They ask about this. How do you assess that the patient actually understood what you were saying? You ask for patient's feedback. And what is feedback? Ask the patient to repeat what you just said to them. But remember, we go step by step. We have to have patience. If we don't have patience to teach our patients, then don't even get involved. Get someone else on board. Get some patience and deal with issues. That's basically what it is. So this is a question for you, but then that you may have in your national exam. Number 1, the answer is there. You don't need to respond, but this is for you to understand. Research has shown the patient education materials should be written at which grade level? 3rd or 5th level grade or grade level? No. So it's 5th to 7th grade level. So probably you heard about this. You have to teach me as if I am in a 5th grade. That's what this particular, I don't know how to say it, saying or whatever, is used. Talk to your patients, talk to me like I'm a 5th grader. That's basically what you have to do. So when you have a question, at which level you should be talking to your patients, 5th level. If they have 5th to 7th level, excellent. So that's basically what it is. But 5th level needs to be included. Because this is medicine, and medicine has lots of medical terms that are very difficult to understand, even though for people who are English speakers. Why? Because medicine is not written in English. Medicine, medical terms is written in Latin, Greek. So how many of you speak Latin? I don't. What about Greek? I don't. So what makes you think that the patient speaks Greek or Latin? So that's why we need to speak to them in a very low level so they can understand. If I repeat it to my patient twice and my patient continues kind of not understanding, you are using the same terms. Change the terms. Paraphrase. That is another answer. When your patients do not understand, what are you going to do? You are going to paraphrase. It's not like you're going to keep on repeating something like a broken record, because if you are talking the same words over and over and I don't understand those words, I'm not going to understand you. I'm just going to get annoyed. I'm just going to get frustrated. No, you find different words. Take this medication before meals. Patient that's not familiar with the word meals. What makes you think that every single patient know what a meal means? Don't. Take it before lunch. Take it before you eat something. Find different wording. Paraphrase. Because sometimes I encounter that situation with certain people explaining the patients. Oh, the patient I told like 10 times and it doesn't get it. Of course, because you are just repeating the same song over and over and over. And I don't understand some of the words from that song. So, hey, if you keep on repeating the same words, well, and I don't understand it, what makes you think that I'm going to understand it as many times as you repeat them? I won't. Let's change the wording. I have one of my patients, you see, when I came to this country, and it says, my belly hurts. I said, my belly hurts. I was looking at the belly button, at the navel. Oh, there is nothing wrong with this. No, around here. I was thinking myself, wow, what an idiot myself. He was talking about the abdominal area. People say, oh, my stomach hurts. But it's not actually the stomach. It's something where the stomach is at. That's what they said. My belly hurts. Lay down on your belly. It's because that is where the belly is at. So you got to find different words to make the patient understand. Don't get frustrated because then you don't have patience. So we have to get a different vocabulary to talk to our patients. And believe me, that's how you're going to get there. Oh, you're talking about your umbilical area hurts you. Umbilical area? What the heck is that? They're not going to get it. Remember, do not use medical terms. Do not use abdominal area, pelvic area, none of those terms, because they're not going to understand you. Look for the common terms that you know that means the same in English in a fifth level or fifth grade level. And believe me, you're going to be fine. Your patient is going to be fine. Your patient is going to trust you. Your patient is going to come. It's going to be very comfortable talking to you. Other than that, they won't. Any questions about patient education? Whatever we have covered up to now? Well, this is the same thing, but once again, is describing the process of teaching patients about medications. I've been talking about that since we start this chapter because that is what the chapter all about, right? So it's very important that we understand. Preparing a teaching plan. Provide considerations involved with presenting education. So once again, well, Seems like it's gonna rain again. We're gonna have a thunderstorm. Hopefully, I don't get my internet disconnected. If for any reason my electrical power, goes off like happened Friday, do not panic. Usually it returns like not far from there, except if it keeps on raining. So if something happens, just be patient and be sending you an email or something like that. Because things happens. It happens in the US, well, it's gonna happen here. So once again, you need to prepare your material in a way that your patient is gonna understand. Once again, use any methodology, any technique, including written images, videos, anything that can help you delivering that information. Remember, when we are going to give patients education, we need to understand what is it that we are going to explain the patient, because if we just reading from a material but we do not understand either what we're explaining, what other words we're going to be using, it's going to make no sense. So we need to understand, before we give instructions to our patient, we need to understand what those instructions are. Now we need to relate the information that we are going to give the patient with, the knowledge, the education level that the patient has. Can the patient understand? Can the patient handle this? Once again, we have to be patient and we have to go slow, step by step. Sometimes, once again, the time constraints. Remember, we don't have enough time. We have other things to do. We're about to have lunch. We're about to go on break. We're about to, finish for the day. And this patient is kind of, holding us down there. So sometimes, you have to do it. It's just that. Particularly if you are explaining the patient the informed consent. Once again, the informed consent is a very, very common question asked in exams. But the informed consent, except for the implied consent, if it is a written consent, needs to be given by the medical doctor. That is basically what it is. But you need to have that informed consent that is written in a document signed by the patient and witness. You need to have it there if a procedure was ordered. So those are the things that you need to understand. If the patient has not been consent for this particular procedure or for this particular medication, you cannot give the instructions. This informed consent has to be done first. That's basically what it is. So this has nothing to do with the questions on your exam. The questions on your exam is, what is an informed consent? What is a consent? What is an informed consent? Consent and informed consent, there are two different things. They are related, but it's not the same. Consent is like you agree with something, but you don't have to sign anything. I'm going to draw your blood. Okay, here is my arm. What should I say? I'm going to do this. I'm going to do that. You just go along with. That is a consent. Informed consent is that I have to explain you the benefits, the procedure itself. What is the procedure? What are the risks doing the procedure? What are the benefits doing the procedure? Who's going to be involved in the procedure? Who's going to be the doctor? So when it's going to be, how long it's going to take? So that is a different issue, but that's not something that you do. That's something that the medical doctor needs to do. But consent, you can get it all the time. Hi, Mr. and Mrs. Smith, I'm going to be doing your vital signs. The patient follows along. You get the consent. The patient didn't say no. I'm going to be drawing your blood, Mr. and Mrs. Smith. Sure. They just nod. They just raise their arm. That is consent. I'm going to be doing an EKG. Okay. I'm going to give you this gown. The patient receives the gown. You place them on a bed. You explain the procedure. You got the consent. So again, the nurses are going to give medications. Do they have to have a written, not for all the medications, but they have to get a consent. So that's basically what it is. So again, inform means I give you lots of details about the procedure and you have to sign a document that you understood the risks, the benefits, what the whole process is going to be of the procedure. So don't mix up consent and informed consent, because that's totally different. Implementing the teaching plan. So remember, sometimes we go kind of around. This is like when you're writing a letter, or let's be a little more simple, an essay. Writing an essay, you gotta go read it. I read my essay several times to make sure that it meant what I want to deliver. And I get someone else to read it to see if a person understands. So the same here, because remember, your patients are going to be very apprehensive. In other words, they are stressed out, they have anxiety, anything that can bring them to the medical doctor, they're just thinking about the worst case scenario. If I'm having some symptoms, the first thing that you think is that the medical doctor is going to be giving them a bad diagnosis. They're going to tell them, hey, you have something that you have these 2 months to live, or they think about the worst case scenario. Whenever you have something, remember what I told you. I black out going down the train station, and the first thought that I have in my mind was, I'm having a heart attack. I'm going to collapse. Because I know what heart attack is, even though if it is a medical doctor, I didn't have no chest pain, but because I was collapsing, I said, oh my God, something is happening to me. Can you imagine if I'm going to the medical doctor, I'm going to be thinking, what they're going to diagnose me with? So I'm going to be very apprehensive, stressed. I'm going to be very anxious. A lot of things are going to go through my mind. So remember, we have to take in consideration all that and kind of switch gears, kind of, change wording. So many things we have to do. Because other than that, once again, and don't give too much information to your patients. When we give diagnosis to the patients, we go very slowly. We start talking about all the conditions that they have and how these conditions are worsened, but we are also related to whatever they have, not that something is new to them, because they can freak out. So the capacity of learning about something is limited sometimes for the patient, because all these emotional, psychological issues that goes through their mind. Always use different methodologies for your patients. Remember, if you have, I would say, combination of methodologies, you verbally explain them, you give written instructions, you show them videos or images, or if something needs to be learned, to do a procedure for themselves, you have to do it. Just show it to them. And once again, always tell the patient that they are doing very well, even though if they are not. It's not that you're lying to them. is that you are encouraging them to do it, to improve, to do it better. Oh, the first part was really good. Let's talk about the second part. Instead of telling them, no, 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 no. The first part was good, but the second, you totally lost. You don't know what you're doing. No, don't do that because you discourage them to continue to learn. Believe me, everybody gets kind of, take it personal because they immediately think, oh, this person thinks that I'm an idiot, that I don't understand anything. So they block themselves. No, encourage them. Oh, that's very good. Yeah, tell me more. You're on the right track. Well, not so much. Let's use this instead. But always be positive towards your patients, because other than that, remember, they're gonna block themselves. Verbal education needs to be individual. When I'm talking about individual is if this information is for the patient, focus on the patient. Even though if you have relatives there, the relatives can learn, they can help, but the focus is on the patient, remember. Remember, written information all the time. The language that the patient speaks. If we have any audio visual resources, we can give them, the link, or we can provide them with the images or the sequence steps printed, anything that can help them out. So again, we need to kind of, be very empathetic with them. Assume that, not everybody learns the same way, fast enough, and then gonna understand. If you have the patience for that, patients are gonna understand. If they feel like you're rushing them, that you're rushing me and you want me to do this fast, it's like you want to get rid of me. You know what? I'm not wasting my. No, as patients, we know as human beings when someone tries to brush us off, trying to get rid of us, just giving the information, at speed of light. So be careful. Have to be very careful what you do, how you do it. Handouts. This is the way that we are going to give written information. It's very, very helpful. Remember, if I have the information right there, you gave me the verbal information, I use the handout, this is written instructions to reinforce what I learned, because all those things now I don't recall them. If I gave you instructions for you to do a procedure or to take a medication, as time goes by, I'm going to forget about all this. Don't you forget all this information or most of this information that I gave you. You don't recall every single chapter, every single line, every single detail. You don't. That's impossible. So for the patient, it's the same. They're not going to recall much information. That's what we give them these handouts or these written instructions, because that's how it works. And we are going to limit, remember, the information, how much information we're going to give you. We're not going to give you a booklet. We're going to give you like a page with a couple instructions, 5, 6 instructions, very simple. So that's how it works. And we are going to make sure that, we are going to use the methodology, the wording, depending on each patient individually. So patient needs to know that this is one topic, one objective, and this is a different one, and this is so we have to kind of, emphasize that. If we don't, once again, we are in trouble. Involve topics that the patient is interested at. If it is medications, give the patients information about what condition they have in very simple terms so they can understand their condition. So now they know that they can follow these steps to take their medications. If that's the case, particularly in this module, that it is pharmacology. So those are the things that we need to follow. It's not difficult, believe me. We just need to get used to. That's basically what it is. So that is basically what it is. Simple terms, that is the key. The language that the patient speaks, not too much information related to something that the patient has, because remember, we have to give information about what they have so they can understand how they can treat it and the importance of following through these instructions if they really needs to get better. So that's how it works. So now, once again, evaluating of learning, one of the things that I wanted to say right here is patient's feedback. Believe me, ask the patients if they have any questions. Don't just agree with whatever they said, thinking, oh, yeah, I'm just gonna finish with this. No, always ask questions. Do you have any questions, Mr. and Mr. Smith, about this topic? Do you want me to go over any of the items within this handout? That's how it is. So you have to kind of be there for the patient. Once again, the way that we know that the patient understood what we explained, remember, is asking for feedback and paraphrasing. These are the two questions for exams, 100%. Go over the things again. If the patient said, no, I'm fine, then summarize whatever you said. Okay, let's go one more time. Let me repeat it back to you. Or you ask the patient to summarize what you just said. So remember, we are working together. I'm not your teacher. You're not my student, because that's what the patient thinks sometimes, that you're questioning them. No, we are learning together here. I'm giving you some instructions because you need this instruction. So I want to make sure that you got this information. Because remember, if we don't get this information through, this patient is going to start calling every single time the office. Hi, listen, you gave me some instructions to do this procedure, but I just forgot. Oh, but I gave you verbal written instruction. I don't know what it is. I'm not gonna go to follow through this. I don't recall. I need someone to help me out. Believe me, you're gonna get pissed off. So you need to be patient. So if we don't give the proper instructions to the patient is not gonna comply with the medication. So the patient is gonna be calling all the time to see how things are going to be done. Believe me, and that is time. I mean, something now you have to stop because the phone is ringing or the patient is right in front of the counter and the patient wants to talk to you because you are the one who gave the instructions. So believe me, the patients are going to get upset. The whole thing is going to change direction. Gotta do what I gotta do. So plan for frequent nurse-patient contact now, or medical assistant contact. So, every single time that the patient comes for something, has a medical condition, talk about the condition, talk about the importance about, following through all the recommendations. That is basically what it is. And remember, don't forget the culture of your patients. Emphasize that it's important for them to follow through for the condition that they have without coercing at them or threatening them. Oh, you better follow these instructions. The doctor is not going to see you if you don't follow through, you stop the medication or whatever. We don't talk to the patient like that, remember. So all the time, be there for your patients. Once again, if you have to repeat it 100 times back to them, you have to do it. That's the only way that you can get things through. Always encourage your patients to be involved in their medical conditions, including family members. Because nowadays, the way that we treat patients is patients center treatment. Now it's based on the patient. Back in the days was based on the medical doctor, what the medical doctor decides, what the medical doctor wants to do, what the medical doctor recommends was done. The patient did not count. Now, no, the patient is involved directly. If you want the procedure, if you agree, you can do it. If you're not agree, there's got to be other options. But you have the right to refuse. You have the right to be involved. You have the right to participate in your treatment, to know what's going on. So things have changed, and they have changed a lot. So remember that those are the points that you need to remember all the time. So that's basically what it is. So be empathetic. Put yourself on the patient's situation. Try to understand why they are not taking the medication. Try to understand why they don't want to, follow the instructions. What is really bothering them? Sometimes it's just our behavior that, refrain the patients from listening, from, kind of understanding what we try to say because they feel like we do not care about them. So show a little more empathy by being patient, have compassion, be nice, greet your patients when they come in, when they leave. That helps them because sometimes, if I'm sick and I go to your office and you tell me what you want, what are you here for? Well, I felt really bad because you have no compassion. You don't care. You have to be nice. You have to welcome me. Good afternoon, Mr. Miss Smith. How can I help you today? That immediately made me welcome. That immediately made me think that you want to help me. Other than that, I have a negative opinion about you. So again, sometimes it depends how we approach our patients. The rapport that we create with our patients on our first interaction, that counts. That counts a lot. Which of the following is the best statement related to medication teaching? Well, let's see. You don't have the answer here. Well, I do. All patients can learn about medications in the same setting. Remember, first of all, when you're learning, when you're taking an exam, it says all patients. That is very general. You know already that the patient needs to be addressed individually because every single person has a different condition, learn things in a different way. So all patients can learn about medications in the same setting. No, that's impossible. This is like, everybody is all the time. All my students are on time in my class. All my students get 100 on the test. That doesn't happen. That is not logic. So remember, for a question that says all the patients, I'm not talking about all of the above. All, always. Those are not the right answers. So that's basically what it is. The method and space for teaching must be designed for each patient. That is the opposite of the first one. And that's exactly what I mentioned. Every single method, every single technique that I'm going to use on my patient has to be designed for that particular patient. Remember, I don't address every single patient the same. I greet them sometimes, but not always. Why? Because if the patient comes, kind of screaming, or I'm not gonna say hi, how you doing, good morning to you, they're gonna feel insulted. No, I have to see the situation first. But when we're teaching, not every one of you are going to understand the same technique. That's why we have a different ways of getting this information through. So that's basically what it is. Using a single teaching method is most effective. No, we have to use different methods because the one that works for me might not work for you. So that's what we went over different techniques, methodologies to teach our patients. It happened the same with my students. Not all of them learn the same way. I have to adapt myself to different teaching techniques. Encourage all family members to be present for each section. Again, all family members, how can you bring every single person from your family, including the babies, the dog, the cat, or the chicken, if you have some? No, but only one person can go there. Never have a bunch of people over there because you're not having a conference. You want only one person, an adult who understands, who is in, good state of mind. And you're going to ask the people, which of you wants to stay in the room that I'm going to give some explanations to Mr. or Mrs. Smith? That means everybody else needs to leave the room. That's how it is. You're not going to offend people saying, okay, everybody leaves, you stay. That is not good. When patients are there, when family members are there with the patient, because sometimes patient comes with 2, 3 people or 2. So then you ask voluntarily who wants to stay with the patient because I'm going to give some instructions so you can assist the patient when they have to follow through these instructions. They themselves disqualify. Oh, I'm leaving. They start, walking towards the door. And someone says, I stay. Okay, sure, not a problem. So that's how it works. You don't want a bunch of people asking questions and questioning you, why this, why that, what do you, no, no, no. You want one person and you're going to be in command. But you're going to be addressing your patient, even though the family member is there, still, you're not focusing on the patient. Don't focus on the family member, even though if you're giving instructions to the family member, it's to the patient. The patient is our priority. So that's basically what you can ask questions. Did you understand? There is anything else that you need? You want me to go through? You can ask the person who is assisting there, who's going to be reinforcing the information to the patient, just to make sure that they have this information. So that's basically what it is. Very important. Question number 3. The medical assistant is developing a medication teaching plan. To make the plan more effective, it is important to do what? So which of these questions you will select? Let's go through it. Teach all the information in one visit. You don't have to read anything else. It says right there, teach all. I told you already that all disqualifies this to be? How can I give you all the information at once? I have to use it pausely. I have to give you some information now, some information after, little by little, so you can digest all this information. So think about it. It's not difficult. Use only one style of providing the information. Only is very narrow. All is too broad statement. So when you see only, all, always, those are not the right answers. They are not. 100% I can reassure you. I have taken tests without not knowing anything. Following this, pass the exam. So it's proven. These are techniques to take exams. Of course, there are certain exceptions to the rule, but you will know those exceptions because they are unique and they will be explained. But once again, only, all doesn't apply, except for all of the above. But once again, when you're taking the national exam, you're not going to have all of the above. You're not going to have none of the above. You're not going to have A and B are correct. There is only one single answer. That's it. Now, number 3, assess the patient's readiness to learn. Oh, wow, sounds like that works. Because I need to see whether my patient is ready to get more information. Are you willing to do that? Do you have the time or the physical or the emotional stay for me to teach you all this? Oh, number 3 sounds like good answer. But the question asks, select as many of the answers, possible answers that you may have. Whatever applies. Request that the patient repeat back information. We went through this, patient feedback. So 3 and 4 applies, right? Because it says assess the patient readiness to learn. Yes. We're going to ask the patient for evaluation, meaning to repeat back, to give me a feedback. So that's how it works. So it's very important, once again, that we follow through this. It is not difficult. Remember, if you learn the techniques to take exams, sometimes you might not be sure because most of the answers sounds like they are correct. Because our mind is, goes everywhere when you're taking a test. Just focus on the question and try to discern the right answer. Don't rush yourself through it. Yeah, don't take too much time because it's a time test. But once again, some of the cues, the tips that I'm giving you how to take a test should help you. But here is logic once again. Any questions about patients' education? Okay, so let's move to the next chapter before we go on break, of course. Yes, we still have some time right here. Okay, next chapter, I believe is this one. Oh, that's not the one. What the heck I did? Oh, this is my chapter. Oh, here it is. Sorry, guys. Excuse my language. What is my oh, here it is. Okay. Chapter number 2, according to the lectures, not following chronological order. Understanding medications. Well, that is something that, you have to learn. So you have to teach your patients, but mostly this is for you. So if you understand the medications, then you're going to be able to answer some of the questions that your patients may ask. So that's basically what it is. So let's talk about these pharmacology terms that you need to understand. So what is pharmacology? Because that's what we're talking about here. That's what this module is all about. So these are medical terminology. So let's break it down because I like to do that. This is part of medical terminology. So logi, pharmac. Okay, so that's basically what it is. Logi is the suffix. This is not. This is the combining vowel. Don't worry about that. This is the word root. Pharma means drugs. Drugs. Logi means study of. So pharmacology is the study of drugs. That's basically what it is. How they work in our body. That is it. Study of drugs. Because remember, drugs, medications, drugs just chemicals. Medication, something that we use to treat you for some medical conditions, right? But in general, alcohol, drugs. So that is what pharmacology is. Remember, pharma means drugs, chemicals, logi, study of these drugs, these medications, and the effects that they have in our body, whether it's good, whether it's bad, anything that has to do with that. Let's talk about pharmacodynamics. Now, dynamics is movement. Movement. How these medications moves within our body. It says right there, studies of the biochemical and physiological effects of drugs within the body. How these medications act upon each of the target organs is called pharmacodynamics. Remember, these medications are going to be intended for this particular problem, this particular tissue, this particular organ. Later on, we're going to talk about how medication goes to this particular organ and it doesn't get stuck somewhere else. So this is pharmacodynamics, how these drugs, works in different targets in our body, not the effects on them, how they reach this particular organ after being administered, whether orally, whether through an injection, any type of injection, or it's being inhaled, or it is being applied topically. So over the skin. So pharmacokinetics, this is another medical term right here. So kinetics, now again, that also has to do with how things, distributes around. Studies what happened, studies what happened to a drug when drug from the time it enters the body until it is excreted. So from where to where it goes. Some of these terms kinds of overlaps. But some of them, remember, pharmacodynamics is where this medication goes in the body, in which effects they do in this particular part of the body. Pharmacokinetics is how it moves through all these systems when we take it to reach that target, that organ, that tissue, that system. So that's basically what it's telling. So I take medication orally. This medication is going to go through my mouth, through my pharynx, through my esophagus, through my stomach. What happened there? Then it's going to go through the small intestine. What happened there? Then it's going to be absorbed. It's going to go in through the bloodstream. And when it goes there, to the place where the medication is intended to do the work. And the changes that it's going to have after it reaches that part is called pharmacodynamics. So that's basically what it is, how the medication moves from the place where you administer it to the intended organ is called pharmacokinetics. What the medication does when it reaches to the part, which is the effects that it's going to do, it's going to fix the problem, it's going to make me feel better or worse, or whatever. That is the pharmacodynamics. So that's basically what it is. Next. Uses of a drug. What do we use these drugs for? See, for me, drug sounds very, I don't like the word drugs because drugs means too much, right? It's a too general statement. It should be uses of medications. But medications are drugs made of chemicals. So for that reason, it's done that way. One of the uses for cure is a curative. Remember, we take a medication because we want to feel better, right? To fix the problem, to eliminate what's causing us the discomfort, whether it's pain, whether it's burning, whether it's I don't know, whatever it is, inflammation, whether it's a disease that we have, we want to feel better. So it's just the curative part. So that's basically what it is. It's going to make us feel better. Diagnostic. Now, as a diagnostic, remember, whenever we diagnose the patient, depending on what condition they have, well, depends on the diagnosis, we are going to determine what drug, what medication is going to be given or administered to you. Now, there are certain drugs that we use to diagnose something. If you remember, for the pregnancy test, we apply some urine on that particular little kit, and then we slide that cassette inside the analyzer, and inside the analyzer, we're going to have some chemicals that is going to be interacting to reveal whether the hormone is present or not. So that's basically what it is. When we use the dip stick, remember to do the urine, that we dip this little strip that has different little squares with different colors. Each one has different chemicals. React when we dip it into the urine, and that is going to help us to diagnose the patient, to see what is it that the patient has, whether it has an infection, whether the patient has blood in there. So whatever the case may be, we're going to be able to see it. So chemicals in X-rays, we use X-rays, radiation, chemicals to diagnose you. MRIs, CAT scans, any procedure that we do that involves using chemicals to detect what is it that you have, or to visualize something inside our body with the aid of these chemicals, is used as a diagnostics tool. So what is it's a diagnostic tool. We have plenty of, so you're going to be learning that sometimes, all these little containers that we give you to collect stool cultures, they have chemicals in there. These tubes that we collect blood, they have chemicals in there. to preserve the urine, to preserve the blood, to preserve the tissue, and on the same token to prevent certain parts of components of the particular body fluid to get damaged so we can evaluate it. See, that is the diagnostic approach of use of drugs. Prophylactics. Prophylactics is very easy because prophylactics means to prevent. This is to prevent. We are going to give you a prophylactic. Remember, vaccines are considered prophylactics. These are drugs that are given to you to prevent you from getting this particular condition. I got the COVID-19. Well, of course, I have the MMR, mumps, measles, and rubella. I have the diphtheria vaccine. I have the hepatitis B vaccine. All those things are to prevent you from getting a condition. So prophylactics are for that. So there are many other things. These are drugs. These are the medications that help you and protect you from getting something. Replacement. Now, these are drugs that are given to you because your body is not producing enough or is not producing something at all. So we need to give it to you. Oh, you don't have enough calcium. Well, we prescribe you calcium, right? That's what it is. And many other things. Vitamin D, vitamin B12, or vitamin 6. Any of these chemicals that we give it to you is to replace the ones that you are not producing enough or that you are not producing at all. Because that's basically what it is. Or something that your body needs because your organ has been removed, your organ has been damaged. Last but not least, therapeutic. Remember, therapeutic means treatment. So I'm giving you medications to treat you for whatever problem you may have. So basically, that's what it is. It's not to cure you. Cure you means to get rid of the condition that is bothering you. Therapeutic is to keep you going on, to keep you out, away from those problems, from those symptoms. See, that is therapeutic or therapy, because there are different ways of giving you therapy. So that's basically what it is. I don't want you to develop pain. Pain is going to be there all the time. I'm going to relieve that pain giving you these medications. It's not curing you. It's not getting rid of the problem. Because cure means removing the problem altogether. So that's basically what it is. Any questions? Okay, if you don't have any questions, let's take a break. We're gonna go on break. We are gonna come back 7:40. So again, don't forget to return to the class. 7:40 it is. Enjoy your break. See you then. Okay.
Okay, teacher.
Thank you. Okay, so we are back. How you guys enjoy your break? Okay. So let's continue then with this
Thank you.
chapter. Oh, you're welcome.
Thank you.
Okay, so let's talk about drug names. This is a very important topic for you guys to understand, because remember, if you understand the topics, the subjects, then you're gonna be able to explain to someone else. So you probably heard about generic, tray, you not to worry about chemical name. Well, let's start with the chemical name of the drugs. So the chemical name is nothing else, all these formulas that you see in the insert of the medication that we have no clue what it is. I don't. I understand some of the stuff in chemistry, but I'm not a pharmacist. I'm not an expert, I'm not a chemist, so forget it. By the way, I don't like chemistry at all. So it's not something that is going to be easy to understand. This is not for you, it's not for the patients. These are for the pharmaceutical companies that manufacture these medications. So they have all these chemicals that they put together to make a medication. So that's basically what it is. All these chemical composition reactions that they have. So that is what they call a drug. So that's basically what it is. So the chemical part is this one right here. This is the chemical. So who cares about chemical part, but you need to know that there is a chemical name of the drug. Remember, this is the one that the manufacturer company, which is the pharmaceutical company, combines all these chemicals and they come out with medication that they're going to give them a name. So the first name that they're going to give this medication when they are manufacturing them is called the trade or the brand name. So let's move this here one step up, because that's how it works. So the first name of the medication, which is created by the pharmaceutical company, is called the chemical name. That's not the name that we know the medication. So do not worry about this chemical part. It's all the chemicals they put together to get a medication. But what is the result of that chemical name? What is the actually brand name that they're going to give this to this chemical name? So that is the trade name. That is the name that the company, the pharmaceutical company, creates, manufactures. They're going to give it a name. Remember, all these chemists, people that works over there in the pharmaceutical company, they put all these chemicals together. Now they know all this is called the chemical name. But that's not the name that we are going to place to sell it. Now we're going to give them another name, because the chemical name is going to be very difficult pronounce, very difficult to distinguish. You're not going to be able to know it. It's very difficult. So then say, wow, this name is too difficult, so let's give a name that is very catchy, that people is kind of going to identify with, and it's going to attract a lot of attention. So let's give it a name. That's going to be the train or the tray or the brand name. So this is the brand or the proprietary. That's basically what it is. So this is the name used for marketing purposes. That is basically what it is. So where is the generic name comes from? So let me tell you a little story because this is not what many people think. See, that's what I'm saying. When you talk to the patients, you talk like you're talking with a fifth grade person because they're not going to understand any of this. You don't have to explain any of this to them, but you do need to understand because we have a problem with patients saying that the generic medications are not good. Oh, they're going to give me generic. That's not good. Well, I'll tell you one thing in advance. Trade is what the company, the manufacturer company gave that name for the first years until they get the money from that medication. Let me explain it to you. The pharmaceutical company spends millions of dollars in research, trying to figure it out, trying to come out with a chemical name, with a formula for a medication. Sometimes they make it, sometimes they don't. Because the medication that they came out with is not approved by the FDA, the Food Drug Administration, which is the one that is going to give you the okay. So put it this way, in simple words, you are taking this course. Somehow, I'm representing the school, you're taking my classes. If you don't pass my exams, you're not going to pass my class. Think about that. So even though if you register for the course, you're not guaranteed that you're going to pass the class. The same goes for the medication. I just giving you an example. The same goes with the medication. These pharmaceutical companies start manufacturing, putting all these chemicals together to create a new medication for this particular condition. But not always the results are successful. Why? Because this medication needs to be treated first or try first, because that's what it's called, a trial. They're gonna try first in very small animals, and if it doesn't work for them, this bunch of medications that they created are not good because the Food and Drug Administration is monitoring all these medications, and you are not going to put it on the market to be used by the humans until the FDA approves them. Has gone through 5 to 10 years of research and trials before the first human uses the medication. So think about it. They spend millions of dollars trying to create a medication, but it turns out that the medication didn't work in small animals, they big animals, and then they're going to try it in humans. But sometimes they don't even get the chance to try it in large animals. So the FDA says no. So think about that. That's how it works. Think about students getting into medical schools. Not everybody made it. When I went to medical school, there were 50 students in my class. Only 17 of us graduated as medical doctors. Just because you register, just because you took some classes, some semester, just because you pay, does not imply that you're going to be a medical doctor. So that's basically what it is. So the same goes with the medication. Now, let's talk about those who make it. Let's talk about these medications that make it through all the process. 5 to 10 years takes for a medication to be approved by the FDA, to be treated, to be tried on humans for the first time. So if this medication passes to be tried by humans, now, if this medication goes well with humans, after this medication is being treated with, being used with animals, now not many side effects, not many, toxicity levels. The FDA gives the okay, the green light, and the pharmaceutical company now brings out to light to the market this medication and is going to give it a name. So let's talk about a medication that you are so familiar with that if you have not taken, at least you heard about it. I don't have medical conditions whatsoever. But sometimes, you have the little flu, the little malaise, something uncountable, and like kind of body ache, something like that. You want to kind of get sick, and you take Tylenol, right? Isn't it? How many of you have taken Tylenol? Well, probably most of you. I'm not gonna say all of you because remember, all of it doesn't apply. But in this case, probably, because Tylenol is a very common medication. So the pharmaceutical company is going to call this new medication Tylenol. That is the brand name. That is the trade name. Trade, brand, the same. You can use these two names interchangeably. Trade because it's the marketable name that you're going to put out there to sell it. So Tylenol, wow, really nice. What a name. It catches. So now, well, how do you get the Tylenol generic? Well, Tylenol has to be in the market at least 15 to 20 years before it becomes generic. Let me go back to this so you can understand. So remember all the process that these trade name medications, trade or brand name medications took to be approved by the FDA, 5 to 10 years. After that, the pharmaceutical company have a deal with the government. The government is going to tell them through the FDA, hey, Tylenol pharmaceutical company, we are going to allow you to sell Tylenol for 15 to 20 years until you get all your millions, the money that you spend producing, manufacturing, researching this medication. So when you get all your money that you invested and you got profits, then I want you to give me the formula for the medication. So the government takes the formula for the medication and the government pays the pharmaceutical company to produce this medication. See, are you understanding a little bit what I'm telling you? So the government is not spending a penny to all these research 5 to 10 years that the pharmaceutical companies spend, not only time, but millions of dollars to manufacture this medication. But the deal is this, that the government allow you to sell your medication with one condition. After you sell all your medications as a Tylenol for 15 to 20 years, we want the rights of the medication. But we are not going to call it Tylenol. Why? Because that is your name. That's you, pharmaceutical company that you created. You manufactured that. So now you're going to give me the formula, which I didn't spend a penny for, getting this medication out. Now the government is going to get this medication through a pharmaceutical company and it's going to change the name. So what is the name of Tylenol as generic? Oh, acetaminophen. Now we are going to call it acetaminophen. So the government calls acetaminophen, but that's exactly the same Tylenol. You guys understanding? That's what it says, official or legal name. It's official because it's the government. Now, when we go to the medical doctor, if we have a governmental medical insurance, they want us to use the generic. Why? Because the generic is very cheap because they didn't spend anything. They didn't spend money trying to manufacture this medication. They got it for the pharmaceutical company as a part of the deal. Now, that's what generic is so cheap. And that's what most of the government insurances prescribe to their policyholders. generic medications. So instead of you getting Tylenol, you're not gonna get Tylenol because Tylenol belongs to the pharmaceutical company. They still sell it and still making profits, but now the government has acetaminophen, which is the generic name, and the government is making money, not much, but they didn't spend any money. Now we can pay you, give you your medications because you are part of our insurance for less than, nothing. So that's basically what it is. So now you understand that trade brand and generic are the same medication, the same components, the same ingredients. It's just that the government didn't pay a penny to get this formula and produce or manufacture the medications. That's what the medication is cheap. Do you guys understand how that works? Anyone has a question? So now you understand what is generic. So when a patient tells you that generic names of medications are not good, that is garbage, well, you're not going to argue with them. I said, no, by the way, generic is a very good medication. Don't explain all the things that I've been telling you here. But don't go by the flow or yourself. Don't think that because the medical doctor is prescribing generic or your pharmacy or your insurance does not pay for brand because it's very expensive. So they go for generic because they want to make money, right? So they want to give you something that is cheap. Now, if you buy it on your own, you can buy Tylenol. So that's basically what it is, or any other medication. But not all the medication has a generic. Why? Because they have not already met the criteria of 15 to 20 years on the market because they are recently new. So medications that are very new, they don't do it. There are some medications that are not generic at all. Why? Because they didn't have a deal with the government. Say, no, we're not going to give you our medication. We're going to keep it as brand name. But those are very, very few medications. And those needs to be given as trade. But there are other pharmaceutical companies that created another medication that is similar to the medication for that condition, that problem, and now they have a generic. So I don't know if it happened to you that you go to the medical doctor, they prescribe, says, oh, go to the pharmacy and pick up your medication because your medication was sent, as an e-prescribe, so electronic prescription. So you don't have to receive the little pad that they used to medical doctors wrote on it and give it to you and you went to the pharmacy. No, now you go to the pharmacy and your order is being given over there. Your prescription is there. So sometimes the pharmacists tell you, listen, your insurance did not cover this medication, or they call the medical doctor and tells them that the insurance doesn't cover that medication. Then the pharmacy offers you an alternative, a generic from another brand. So that is basically what it is. So this is very interesting as long as you understand this. So for your own good, when you receive a generic medication, they're not giving you a piece of crap. They're giving you the real medication. It's just that, once again, this is the process that this medication, every single medication goes through. And then most of them, 98% of the time, becomes generic. So that's basically what it is. Any questions about chemical name, trade brand name, or the generic name? Good. I thought I was going to have lots of questions. I said, oh my God, this people is going to bombard me. Oh no, it doesn't work. I use it. Well, anyway, seems like however you use it is good. I give Tylenol mostly because Tylenol is safer than the other anti-inflammatory medications or antipyretic medications. So that's basically what it is. It's safer than the others. Drug labeling information. So once again, every single medication is going to have a label. Remember, what are the major points, notes, information that has to be within a label? The name of the medication. They have all the names, believe me. You're gonna have the brand, you're gonna have the generic, you're gonna have the chemical formula there. You might not see it, but it's there. You're gonna have other instructions, how many milligrams or milliliters this medication, whether it's liquid or solid, comes. Whether it's a tablet, whether it's a pill, whether it is whatever it is, they're gonna tell you what is the form of the medication. So they're gonna give you all this information. How many pills are gonna be on that bottle or on that particular container, whatever the case may be. They're gonna tell you. They're gonna have information there. How many of them are you supposed to be taking per day? How often you're gonna be taking per day? Is one per day, every 4 hours, every 8 hours, every 6 hours, every 12, every 24, every other day, whatever the case may be, that information is going to be there. So we need to read it. Because later on, we're going to learn that, medication that is dispensed means that it has been given to you already, is being prescribed, comes in certain forms and shapes. And there are some medications that you cannot divide. Oh, that tablet is too big to swallow. I'm going to cut it in half. No, I'm going to crush it. No, there are certain things that you should not do because the information is written on the label. And the medical doctors sometimes tell you what to do, basic things with the medication before you take it. How, at which temperature you should be keeping these medications. So for which period of time you're going to be taking these medications? For 5 days to 20 days, 30 days, whether you have refills or not. Not every single medication is going to have a refill. Not every single medication is taken in regular basis for 30 days and thereafter. No, doesn't work that way. That's what we have to follow. All the instructions that are written on the label of the medication. So once again, we have to educate our patients. But in order for us to educate our patients, we need to educate ourselves first. Any questions about information contained within the labels of the medications? Let's talk about now what factors affects drug actions. Think about this. What affects communication with your patients? We have a bunch of things that we discuss, right? Well, what makes you think that is any different from taking a medication? So let's dive in these particular factors that, affects the drug action, meaning that the drug does not work as intended. That is basically what it is. Diet. Certain foods might delay the absorption of the medication. So we are talking about these medications that are taken orally. That's why medications are given with instructions. Take these medications before meals, before lunch, before breakfast, before dinner. See, that is the reason why. Because if I give you this medication and the medication is supposed to be taken before meals and you take it with meals, now the effect of the drug is going to be slowed down. It's not going to be absorbed as intended. It's going to take too long for the medication to reach the blood flow, and from the blood flow to reach the target organ where this medication needs to do its work, its effect. So again, just talking about food, it is crucial. So they ask you to take these medications on your empty stomach. So that is before meals. Some other medications are prescribed to take after meals with your full stomach. Why? Because these medications are very irritants. They damage the inner layer of the stomach. That's what you develop acid reflux. That's what you develop gastritis. So that is basically what it is, because the medication contains some ingredients that are very acid. Plus, the acid that the stomach produces is going to increase the acidity level, which is going to damage the inner layer of the stomach. It's like it's going to burn it. That's what you call it, heartburn. That's what you feel, that uncomfortable feeling inside your abdominal area and part of your chest as the food kind of moves upwards through the esophagus and it burns. And sometimes you feel like something coming out your throat that is very bitter. So that's basically what it is. So again, we need to understand how medications work. Because if we don't, and if we don't take in consideration all these factors that affects drug action, then the medication is not going to work. And what it's going to do is it's going to cause us some harm because we put in some chemicals there that they do not belong there, that are not doing its intended effect. Instead, they are causing something else. So that's basically what it is. Let's talk about environment. Medications are supposed to be kept like a room temperature. Should not be too hot or too cold because it's going to damage this formula, this chemical compound that it is within the medication. It's not going to be, viable. So these medications are going to die, are going to get damaged, are going to die. I was thinking about something else. So that's basically what it is. Think about a piece of meat or a cheese that you buy. You're supposed to be keeping it refrigerated. If you don't, it's going to spoil really fast. If it is too hot. Well, for medications, either or, higher or lower temperature, not good. They're supposed to be kept at room temperature. Psychological. Now, we are talking about emotions, psychological state, like stress, depression. When you have this type of mental conditions, psychological conditions, emotional conditions, this medication needs to be adjusted. Why? Because when you develop these particular different mood changes, so to speak, like you change from being, acting almost normal, now getting very stressed, very anxious, very depressed. There are different changes in our system. different hormonal changes. And some of these hormonal changes are the ones that helps to slow down or to speed up medication rate, the absorption of the medication, I might say. So that's basically what it is. So considering what is your mental condition, we have to adjust the dose of the medication. Because if we don't, then this medication is not gonna do its work. Simple. Think about diet. Think about eating a medication with your full stomach when it was supposed to be empty, or vice versa. You're gonna have some, consequences, some reactions that weren't what was intended. So psychological, age, gender, body weight, disease status. So physiological, remember physiological changes, but all these physiological, psychological changes are kind of overlapping themselves. Now, medications based on age. Children gets a smaller dose versus adults versus elderly patients. So we don't give the same dose for everyone, or the same dose even though if you have the same condition. Why? Because we have to check also gender. Females usually receive a lower dose than males in certain medications, particularly those medications that are water soluble versus oil soluble. That might be more for females because females have more body mass, more body fat. So that can also alter how the absorption of the medications, depending on whether it's water soluble or fat soluble. Body weight. Well, we are based. This is important. Please pay attention to this. This is a question for exam. I totally, just that I see it, I was like, okay, let me see. One of the major things that we do when we are going to calculate medications is we calculate the medications based on body weight, not body height. We calculate based on age, body weight. Of course, gender too, but most of the time is body weight. Why? Because a child can be 5, 6, 10 years old, but he weighs less one from the other. So age is important, but body weight is more crucial because we are going to give a little more medication. The dosage is going to be a little larger if you have more body mass than the other one, even though if they have the same age. So that's basically what it is. So we give medication based on body weight. We calculate medication based on body weight. So that's basically what it is. So whenever you see a question in your exam, then it says, the patient is going to receive this particular medication, or they're going to remove this particular amount of blood, how you calculate based on what? Weight. Check weight for everything that you see. If the weight is not there, then you select age, because that's another one. But body weight is kind of more of a, deal breaker if you don't follow through. Of course, disease status depends of how advanced your condition is. Sometimes we have to change, the dosage, change the medication, or your medication actually doesn't work. Because most of the tissues, most of the organs are failing. They're not doing their work. So the process of absorption are not there. It is very limited. Or excretion, which we'll be talking later on. But in this process will be how the medication actually enters the body and how, reaches the blood flow, and then from the blood flow reaches the target organ. When I said target organ, is the organ that has the disease, the organ that needs to be fixed, or the part of the tissue or the muscle. So if you have a headache, this medication that you're taking needs to go to the nervous system. If you have a muscle pain, this has to go to the muscles. If you have a heart pain or heart condition, it has to go to that will be the target. If your joints are the one that you have pain with, then the target would be your joints. So the medication is going to go where you have the problem. Later on, during these chapters, we're going to talk about how the medication knows how to go there. How do I know that I take a medication and this medication is for a headache and it goes directly to the nervous system instead of going to my liver, to my kidneys, somewhere else, to my muscles? Why it doesn't go there? Because we're going to learn how medications, what is the dynamics, pharmacokinetics. We're going to kind of apply whatever definitions we covered at the beginning. So that's basically how it works. So remember, there are many factors that affect the drug action. Not to mention, if you take it, this will be, kind of very settled kind of things, right? Because we are assuming that the patient is going to follow the instructions and they're going to put it through, right? But remember that other factors will be patient non-compliance. Patient is not taking it as prescribed. So that's basically what it is. Now, there are other medications that you might be taking that might be interacting with this medication that also can affect the drug action, can increase the potency or can decrease its effect. So that's basically what it is. Factors that determines drug dose. See, I mentioned it already because we covered this: age, weight, and gender. So when we calculating the dosage for the patient's medication, we take in consideration all these factors. So think about it. Age, I mentioned it already. The children, the infants, the young children, the older adults require altered doses amounts. So it's different the amounts that you're going to give to each one of these particular ages groups. So that's basically what it is. So once again, you're not going to give medications to a child the same that you give to a younger adult or to an adult or to a elderly person. So that's basically what it is. The weight, because remember, this medication is going to be distributed between our body, and body mass is very important. So if someone is skinny, well, you're not going to give the same amount of dose of medication as if someone is obese or someone is overweight, regardless of whether they have the same age. Gender, remember, less muscle mass and hormonal differences between men and women alter dose given. So men, usually have more mass, more body mass based on muscle. Females, on the other hand, they have more body fat. Remember, females, breasts, hips, more body mass. I'm sorry, body fat versus males. So we take in consideration, because remember all hormonal changes. Remember, hormones can slow absorption rate or increase absorption rate. So during those hormonal changes, some females, we have to be careful with certain medications, because that can affect the potency, the effect of the medication on the patient. So take in consideration these major groups. Remember, this is to determine the drug dose. The other one is that affects the drug action. That's basically what it is. And once again, if you don't take it on time, also it's gonna alter the drug action. So remember, weight, age, and gender, it is used to calculate, to determine what is the perfect dose for this particular patient, for this particular medication. So that's basically what it is. So remember, for your exam and national certification, whenever you see whether it's going to be blood that is going to be collected for a child, for an adult, mostly for a child, it is based on the patient weight. Because about medications, they don't ask much. But these factors also determines, the volume of blood that it needs to be collected from patients, particularly children. Any questions about factors that can determine the action of the medication or the drug dose that we are going to administer to the patient? Okay, so here it is, factors that affect drug effectiveness. Now, again, weight, body surface area, blah, 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 blah. You can read age, particularly, once again, little kids, body mass, electrolyte balance. There are many things there. The disease in process, if you have a condition that is worsening, medication is not going to be the same as when the condition started, because now it's getting worse. So I have to add the medication, the dosage has to be increased, or add another medication, and so on and so forth. So many things that can change. Tolerance. This is one of the last ones right here. Tolerance means that your body got adjusted to the medication, and now this medication, at the same dose of medication, is not good enough. Let me give you an example, because it's a lot easier when we talk things about the things that we know. Think about alcoholic beverage. I don't drink alcohol, but when I was younger, I had a couple of drinks or vodka, something like that, and I end up in the hospital. So since then, I don't drink alcohol. So, but think about this. You have a drink. If it is for the first time that you have a drink, that probably is going to get you drunk. You have tried that, because I know you have drunk at least once in your lifetime, just like I did. I'm not saying that you're an alcoholic, people, don't get me in trouble, but most of the people in social occasions, hey, social gathering, you have a couple of beers, wine, champagne, and other liquors, of your choice, who knows? But what I'm trying to tell you is that when you drink for the first time and you drink just a little bit, that gets you high. That gets you kind of drunk. Now, if you keep on drinking, that first amount of liquor that you ingest at the first time is not going to be enough. Next time, you want a little more because the same dose ain't working. So now you have two drinks. Now you get high. You have the same effect that you got the first time that you have one. Now, the third time you're going to be drinking and you're going to drink one, that's not going to be good. Not to the level that you want to be. Then you're going to have two and you're going to say, not enough. I need the third one. Now, the third one already make you high. As for the first time when you got one, you got the same level of euphoria or happiness or drunkenness, whatever you want to call. Well, as you continue drinking, your body is not going to get the same effect with the same dose, the second dose, the third dose. It needs more. Well, that is called tolerance. And that's why people becomes addicted to medication. That's what they become addicted to alcohol. That's what they become addicted to nicotine, and so on and so forth. So that's basically what it is. So you see someone drinking a bottle of beer. Oh, that is like water for them. I drink a bottle of water, I'm getting drunk because I'm not used to alcohol. Once again, that's what I'm trying to explain you, because alcohol is like more familiar with all of us because it's something that, somehow most of the people do it. So that is tolerance. So that affects also the amount of drug and the effectiveness of the drug in the target organ. So you see, there are many things that we have to take in consideration when we give medications to our patients. This medication is not working, so then we're going to increase the dose. Oh, you will start with 5 milligrams. Now 5 milligrams do not work. Doesn't do the same effect. You kind of feeling all the symptoms. Oh, we're going to increase it to 10. Oh, you're feeling good now. You're not having those symptoms anymore. Well, you have it, but you're not feeling it because the condition is still there. Then you take this medication for quite some time. They don't work anymore. Now we're going to increase it to 15 milligrams. If that is the case. Otherwise, we're going to add another medication that is going to synergize with that one, but it's a different one, because we are not allowed to give you more dosage, increase the dosage on this particular medication. So then we have to add another one. Remember that I told you that I was taking these antihistamines for my allergic reactions. That was the seasonal allergies. It's not an allergic reaction that I'm going to end up in the hospital. No, it was kind of, runny nose, itching eyes, burning eyes, very annoying, and sometimes sneezing. I don't like that. I'm a teacher, I'm a doctor. I don't want to go to see my patients and my eyes are red and itchy and runny nose and sneezing all the time or coughing. I don't have the cough. Usually I don't get cough. But can you imagine how uncomfortable it is? Just taking the public transportation is making me feel uncomfortable. So then I need my antihistamines. But I took them for quite some time. They worked, but then no longer worked. I have to try another medication. And then the same, that is called tolerance. Any questions about these factors affecting the amount of medication prescribed and its effectiveness? Anyone? Okay. So I hope that, at least you're getting some basics. You don't need to know these by heart, but at least that you have something, I'm placing a little seed inside your brain. So now you can understand why certain things do not work the way that we think they should work, because they have a different process. Okay, so here it is, effects of aging on drug metabolism. So what is metabolism? Number one, metabolism is how the cellular level take these chemicals and creates a reaction. So this reaction is going to cause the effect of these chemicals inside each cell, because each cell, remember, is a living organism. So we need chemical reactions in the cell. These are the first processes that happens in the living organism, and we are made of cells. So everything is starting in the cells. So that's basically what it is. So here is how these receptors, because we have receptors in each organ, each tissue, and these medications are intended, created with the receptors that are going to fit right with the receptors of the organ intended for these medications to do its effect. So that's basically what it is. So our body has receptors, and the pharmaceutical company knows that. The people that works there knows exactly what type of receptors are in the brain, in the heart, in the stomach, in the muscles, in the joints, in the nerves, everywhere. And these receptors are different. So they have to manufacture this medication based on the target cell. It's going to go to the nervous system. Oh, the nervous system has these receptors in this shape. So we're going to do another receptor with our medication that is going to fit right there. This is like a glove that fits in the hand. So those are receptors. That's how the medication knows exactly where to go within the body. This is like, you heard about a magnet, right? That is attracted to metals. That is identical to the medications. We take the medications either route, whether oral, whether intradermal, whether intramuscular, intravenous, inhale, topical, through a patch. Somehow we take this medication, and this medication is going to go to the blood flow. It's not going to stay in the stomach. It's not going to stay in the blood. No, it's not going to stay wherever we place it in the muscle. No, it's going to go through the muscle to the blood flow. It's going to go through the stomach, through the small intestine to the blood flow. It's going to go through the nose if we inhale it, through all these channels, through the lungs, through the blood flow. Medications are going to end up going through the blood flow because those are called systemic medications. So that's how it works. Now it's going to be some type of metabolism, how this medication is metabolized, broke down. So it has to be breaking down. You're not going to take a medication that comes with a bunch of chemicals right there to protect the medication. It's like an egg, has a shell, and that shell is to protect the content inside. And if the shell breaks, the content inside the egg is gonna be spoiled if you're not using it, or it's gonna be damaged before it reaches the target cell. So that's basically what it is. Then it's going to be absorbed. Then it's going to do its effect. Then it's going to be excreted. So that's basically how it is. This is a process. Everything that enters, think about food, enters our mouth, goes to the stomach. There is going to be digestion. It's going to remove whatever is not needed, goes through the large intestine as feces, and all the nutrients are going to be in the small intestine and absorbed to the blood flow. And from the blood flow, every single cell is going to receive the nutrients. Well, the medication follows the same process. We're going to take it. Either route is going to end up in the blood flow, and then from the blood flow is going to pass through the liver, because the liver is the major organ that synthesizes, metabolizes medications. The other one is the kidneys. So from there, the medication now is going to be kind of broken down, metabolized. Now it was inactive. Now it's going to become active. Now it's going to go to the blood flow again, and it's going to go to the target cells because it's looking at the receptors compatibility. Remember, that is like a magnet that is looking for the metal part where they going to, meet, kind of thing. So that is basically what it is. So it is important for us to understand that this medication has a process, just like food. Beans, meat, eggs, fish do not go into the blood flow. It is the proteins, the minerals, the vitamins, the water, what the fat, the cholesterol, and the sugars that is going to be going to the blood flow. And these are the ones that are going to go into the cells to be metabolized. So now we can use it. So that's basically what it is. But then we have to remove all the wastes after, that is excretion. So we have to remove anything. So whatever enters is being used, consumed, but then it's going to have some waste material. We're going to remove it. That's why we check blood, to see the levels of the medications, to see if you have any medical conditions. If any one of you is taking medications or a family member, a friend is taking medications and they have to go back to the medical doctor to be reevaluated after they start you with medications, what we do is we check your blood to make sure that the levels of the medication is not reaching the toxicity levels, or even worse, the lethal level that's going to kill you. Because medications, even though if they are medications that are prescribed for you, and if we don't control how this medication is metabolized, and if it is accumulated inside your liver, it's going to kill you. It's going to damage your liver or your kidneys. So we need to be evaluating you continuously. In other words, we need to monitor the levels of the medication the same way as we check the glucose levels, the cholesterol levels, the sodium levels in your blood. We can check the levels of medications as well in blood. So just because the medication is not doing any effect or positive effect, let's put it that way, for your condition does not imply that the medication cannot cause toxicity. So we need to control. Some medications, we give a certain amount of medication, but then as the condition kind of tapers down, we start taping down medications as well. If the condition start increasing, we start increasing the dosage of the medication or adding another medication if we cannot increase the dosage of medication. So everything is a process. So that's how it works. It's not like I take a medication and now I figured it out how the medication is going to go there. Oh, it's just go there. No, it has a process. And sometimes the medication doesn't reach the target cell. Why? Because there are other organs that are damaged. There are other conditions that kind of blocks these medications from moving farther. So then we have to use other approaches. So that's basically how it is. That's what you see sometimes, that medications, not all of them are oral medications. We have intramuscular medications because we have problems passing them through the stomach. We have intravenous. Why? Because we have problems with other methods. We want to apply the medication directly into the blood flow. Now this medication is just going to go through the liver, through the kidneys, right back to the, to the target organ. So that is how it works. Everything has a process. Any questions about the effects of aging and drug metabolism? Remember, our body is changing continuously. From little kids, we are growing, 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 growing. If it reaches a plateau, which is the adulthood, but now age related only. But if you have medical conditions during any of those ages, the process of the medication metabolism is going to be different. And as we, grow and, reach, become older, changes in our body also occurs, not necessarily due to medical conditions. Probably you don't have medical conditions. Like me, I don't have medical conditions, thank God. But, I'm aging, so medications do not work at the same way. So the amount of medication is not going to be the same. Body mass wise, the same. I'm skinny. So if I were, overweight based on my height and my age, more likely my height, then, medications level, dosage needs to be different. So lots of things changes for us. So based on that is where the medical doctor decides what is the dosage of your medication. Remember, based on age, gender, medical conditions, weight. That is crucial. If we don't follow all these guidelines, then we are not doing a good job. Patient is not going to get better, or patient is going actually to get worse. Okay. Any questions before we move to the next level? Dose terminology. So you are not going to be asked about this, but it's very important for you to understand. Average dose of medication. What is the average dose of medication? Remember, average is like a default kind of thing. Amount proven to be effective with minimal side effects. This is the average. This is kind of not the minimum, the minimum amount of drug, but it's remember, because we have to take in consideration weight, age, and gender. But yes, certain amount of medication that actually causes an effect on the condition of the patient without so many sides. That is the average dose. It's an average. Think about your grades. You're not getting 100, but you're not getting less than 70. You are average. You're in between 70 and 90. See what I mean? So you're not at the extremes. You're an average. Staying there, staying there. You don't have, the only thing you have to do is to pass. That's an average. You're not failing, but you're not on top of everything. It's just an example that I'm giving you. It's not that I'm telling you, hey, you're not doing good or anything like that. I didn't say that. So again, think about it. Cumulative dose of medication. What is the cumulative? Total amount in the body after repeated dosage. Think about this. This is medication that accumulates in your body as these dosage are continuously administered to you. That is when we have to be very careful, and that's what we do, the monitoring of the levels of toxicity of medication in your blood. Because we don't want you to have too much of the medication without being used. Because remember, if you take medication once per day, you have to have this medication. It's not going to be going in the whole medication. It's going to be waste or use in the first hour. No, that medication needs to reach and be used for a period of 12 hours. So the next medication needs to kick in right after the other one is kind of fading off. Now, here is where what I told you before. If you are not taking your medications religiously as prescribed, if I'm telling you to take these medications once per day and you start 6 in the morning, at what time do you have to take the other medications? 6 p.m. It's every 12 hours. If it is every 24 hours, 6 in the morning again, you have to take the other medication because this is the time that the first medication faded off. This is like a chain. This is like a domino effect. If you don't have the other piece of domino that is going to collapse the one in front of it, then the effect is going to be broke. This is like cutting the chain. One of the links is removed. How you are going to continue? But in this case, this is the cumulative time because it's for the time that the medication needs to do its effect. Now, if much of this medication stays from the prior one, from this one, and you're getting kind of residuals, medication is not being used, now we're having problems because now it's going to become a level of toxicity. We will discuss that later. Little dose of medication, the amount of that medication that proves deadly. Remember, little means it kills you. Think about an overdose. That's exactly a little dose. You're taking more medications than your body can handle. That's basically what it is. These chemicals are very harmful. We are not taking, appropriately. Little dose is an overdose right there. It kills you. And we're going to see that you can get killed with an overdose of oxygen, an overdose of vitamin B12 or vitamin B6 or vitamin D. Anything that goes in excess to your body is going to damage it. It's going to collapse it. So that's basically what we need to understand. So these are the terminology that we use. And, when it comes to dosage or medication administration. Toxic dose of medication. Amount brings about harmful side effects. So toxic should be before the lethal. Somehow, well, probably when I was working with this PowerPoint, I didn't fix them up correctly, but toxic goes first. Remember that I mentioned? Because before you get the lethal doses, you have toxicity. Now it's when you develop all these bad side effects. Just side effects make you feel very uncomfortable. Might be nausea, vomiting, abdominal pain, dizziness. So all those things can be diarrhea, who knows? That will be the toxic. Then the lethal will be too much that causes your body or that particular organ or system to collapse and cause you to die if there isn't, medical intervention right away. Maintenance dose. Now think about the maintenance that you do to your car. The maintenance that they do to the building to keep it clean, to keep it looking nice, and everything working normally. So amount needed by the body to maintain desired effect. That's basically what it is. That's the maintenance. So what is the maintenance of the medication? Well, that I have to take medications every 12 hours, every 24 hours for this period of time, because that's the amount of medication that my body needs to get the desired effect, meaning to fix the problem, the symptoms, the condition. So that is maintenance. So maintenance is good. Anyone who's taking medications on a regular basis, you're in maintenance. But then you're taking certain amount of medication, which is the average dose. Because that's what you need. But you're going to be monitored. You have to by your medical doctor. So whenever you go back to the medical office, think about this. Sometimes it's not that I have to tell you. I'm not going to tell you, oh, listen, I need blood because I'm going to monitor your medication. No, I just need to draw some blood. And then I'm going to check if the medications are working, are too much, any level of toxicity, or else, or it is accumulating too much. So that's basically how medications work. It's not complicated. It's just that, if it is not something that you have learned before, and well, you're going to be understanding now because it's kind of basics for you to understand the dynamics of the medications. It's not like one medication fits all or cures all. No, these medications are, tailored, customized for each individual. Even though if I have the same condition as my neighbor, as my friend, as my family member, the medication dosage for me is going to be different based on my age, gender, and weight. Remember, and of course, other medical conditions. Because remember, other interactions that might have the medication that I'm taking, and it's not doing its intended effect, is that it has interactions with other medications that I'm taking for other conditions, whether it is increasing it or decreasing it or blocking it completely. Or this medication that I'm getting for this condition is blocking some other medications for other conditions. So remember what I said at the beginning. The medical doctor needs to evaluate what medication the patient is taking. That's why they take medical history. What conditions do you have? Are you taking medications for those conditions? What medications are? What is the name? What is the dosage? How often you taking this medication? Why? Because if I'm going to prescribe another medication, I have to take in consideration other medications that you're taking. That's how it works. Otherwise, I'm going to end up giving you a toxic level of medication or a little dose. Because remember, these medications can interact with others, increasing their potency or decreasing it or blocking it completely. None of those effects we want. We want that the medication that I'm giving you is not affecting the other medication that you're taking for other conditions, but it's working for the medication that I'm diagnosing you now. So that is the purpose. Everything else doesn't work. Let's continue with this dose terminology. That will be the last slide that we're going to cover. Divided dose. So think about this. This is total of drug administered in separate doses. So makes sense. A divided dose is the amount of the medication that is going to be administered, but it's not going to be given at once. It's going to be kind of giving it in different times, in different amounts. So I have prescribed you 10 milligrams of a medication or 10 of 15 milliliters of medication. We're not going to give it to you like that. We're going to give you 5, 5, and 5 in different times. If it is a tablet, if it is a pill, the same. If I'm prescribing, let's say, 500 milligrams, 800 milligrams of this medication, I don't want it to give you at once. I'm going to give you 200, 200, 200, and 200, or 400, 400. That is called divided dose. Initial dose, very simple, is the first dose that is given to the patient for any given condition. That's basically, that's the initial dose. I have to start you with an initial dose, of course. So this is the first time that you're going to take this medication, or I'm going to start you with this new medication. That's the initial dose, the first one that's given to you. Maximum dose. Now, this is the largest amount that I can give it to you safely. That's the maximum. So let's say then Tylenol, depends of your body mass. Tylenol comes in 200, 500, and 1,000 milligrams. Let's put it that way. So 1,000 milligrams is the maximum dose that can be given to you at once. Not as a divided dose. That's the maximum dose that I can give you at once. And it's safe to you. That's basically what it is. Minimum dose, the opposite of maximum, the smallest amount prescribed that is going to cause the same effect. So this is the medication that, it's going to be good enough. It's like an average kind of thing. But as the minimum dose that can cause a good effect to you. So if I know that I can give you 500 instead of 800 milligrams of medication, and 500 is a good amount for you, I'm starting you with 500. That's the minimum. Now, certain medications are given, once again, we will discuss that in other, slides and chapters ahead. But for now, we have medications given in different shapes and forms. Liquids, solids, ointments, patches, inhalers, meaning powders. There are many ways they can give medications. Well, there are also medications that are being given using a unit dose. What is a unit? Something that is already pre-measured, pre-packed for this particular. So we cannot remove or decrease the dose or increase the dose. It's whatever comes in that particular pre-measured syringe or any other, devices that we are going to be administering this medication. That's exactly the amount that we are going to be giving to our patients, regardless of who they are. They already come pre-packed, pre-measured. You do not give half or 3/4 or a quarter more, a quarter less. No, this is the unit has to be given completely. We don't have to measure it. It's already measured. Versus other medications that we have to actually withdraw from the vial, measure the amount that the medical doctor ordered, and then administer that to the patient. Here, it comes already pre-measured, pre-packed. That's it. That's all you're going to give. And this is good for, to prevent medical errors, to prevent side effects, levels of toxicity, or lethal dosage. Why? Because we're not going to make mistakes trying to withdraw the medication and got too much, too little, or got the wrong medication. So that's very good. There are many medications, easy to apply, particularly for